Everybody, my name is Kirti Mishra. I'm a physician at Metro Health Hospital Systems, and I'm a reconstructive urologist. Today, I want to take the opportunity to have a one-on-one session with one of our patients here at Metro Health who recently underwent bottom surgery with us. And I would like to welcome Ginger Marshall, who is a good friend, but also now a patient. And we thought that this would be a unique opportunity for us to have a discourse between a physician and a patient, but also a provider, actually, as Ginger is also in the medical field, and really get a chance to understand what it's like going through the transitioning process from the beginning, and then more recently, actually having undergone her gender confirming surgery, the bottom surgery. So, Ginger, welcome. Tell us a little bit about yourself, and we'd love to get to hear about your journey through the early transition process, how you realized that perhaps this was something you needed to do, and then we'll take it from there and talk a little bit more about your medical care thereon.
Okay. So good morning. As Kurt said, I am, or as Dr. Mishra said, I am Ginger, and I wrestled for at least a decade around gender identity and coming out and experimenting a little bit. In 2012, my wife and I moved to Cleveland and started seeing one of the physicians at that point it was the Pride Clinic at McCafferty was the only place to get care. And in the right at the end of 2012, I had talked to my wife and my doctor about transition, and I had gotten to the point that I was quite depressed and just not doing well. And so I talked to them, and then I spent a little bit of time. My wife needed some time to adjust, and I realized that it was a transition for her too. Things are going to change, and I could be patient. I was also working on myself a little bit, and finally, in June of 2014, I started taking hormones and move forward. I mean, everybody's path is different. Everybody's path is the same at that point. You take the Feminems is what I was on. It was not on injectables and
Nice.
Spiro. uh, and it took me, I started coming out to people, and my last place to come out was at work in May of 2015. So that was like 11 months later. I had my name changed at the end of the summer and was quite happy. Everything was going well. And then in 2016, I had an orchid. And on the one hand, it was the best thing I ever did. On the other hand, I got it from that guy in Michigan, I won't say any names, who does it outpatient. And I did that because my insurance at the time wouldn't cover it. And I ended up with a horrendous infection, was in the hospital for 6 days, antibiotics, really good pain medicine, because I was in huge pain, and then about another 8 weeks of wound care as it healed. Despite all that, I'm still thrilled that I got it done. It made a whole lot of things a lot better. And I could also get off the Spiro, which, comes with all those delightful side effects.
Right.
I moved forward, and quite honestly, while I occasionally thought about surgery, I knew that financially it was going to be beyond my reach, realistically. Um, and then I changed jobs and started working a place with better insurance coverage that covered it well. And again, I was thinking about it a little bit, and then was part of helping Dr. Mishra and Dr. Vargas get the program started here at Metro Health. And I thought, I put all this work into helping start this program. I might as well jump on an operating table and get taken care of. And so I actually saw Dr. Mishra as a doctor end of October of last year. Saw Dr. Vargas a couple of weeks later. She is with plastic surgery. So Dr. Mishra did most of the inside stuff. Dr. Vargas does the outside stuff, and puts a pretty top on it. Um, and so I then had my surgery February 27th.
Yeah, that's it's funny how that worked out, Ginger. I mean, I would have never thought that you would be our first patient here at Metro Health, but I suppose that, goes to show that we really believe in what we're doing, and not just from the provider perspective, but from a patient perspective as well.
Mhm.
And it's been a pleasure, obviously, taking care of you since the surgery, or even before the surgery. Now, taking a step back, just for our patients who are early in their transitioning process,
Uh-huh.
what do you think about, as far as how should a patient go about accessing care to begin with? Because that can often be a challenge. And, especially if families not supportive or they may not have insurance and so on. At least within
Right.
our community, what are some of the options for patients? And then the second part of the question is, as far as people who are considering having an orchiectomy, can you talk a little bit about what were some of the things that compelled you, or perhaps were enough of a reason for you to proceed with an orchiectomy? Because obviously, it's another surgery, and some providers may say that it may lead to atrophy of the scrotal tissue. So,
Right.
were those some things that you thought about?
Yes. So getting into care is fairly straightforward. Here in Cleveland, we are in one of the gender change capitals of the world. I very happily say that you can get excellent care in at Cleveland Clinic in their Lakewood location. Um, University Hospitals has a wonderful program to start hormones. I personally think you get the best care at Metro Health, but patients do go back and forth as their insurance changes or they move or some other situation comes up, and we all know each other. We all work together to make sure that you all get the best care that we can give. Um, and basically, to make it real simple, here at Metro Health, with most of our primary care providers, we have 9 doctors in the Pride Network who see adult LGBT patients. Getting into the Pride Network is a case of calling a phone number, making an appointment. All of them can take care of gender transition. Uh, with most of them, you have an initial appointment, history, physical, go into things, talk a little bit about if the reason you're going is to get on hormones, talk a little bit about that. They take some labs. If you've got established care with one of those doctors, same thing. You make an appointment, go in to talk to them about transition. They'll take history, they'll talk to you about it. At that point, they may review or give you a copy of the consent form just so you can start looking it over. You get a full set of labs. We want to make sure that there's nothing else going on that could be a problem. Um, and then you come in for your next appointment, and as long as there's no health problems or physical health or mental health problems, you can start on hormones. And they work on the ramp up and everything, and get you started. Now, one of the nice things about Metro Health is, yes, we do love insurance. We don't necessarily like insurance companies. Ooh, I didn't say that part out loud. Um, but we are also the safety net hospital. So if you are without insurance, if you don't have financial resources, if you're underinsured, we also have programs to help you there. And that is one of the big advantages of Metro over the other hospitals in the area. But you'll start your hormones. I think most of the doctors do labs in 90 days. And you come in, you get a check, they make sure what your levels are, may increase, may decrease, see how you're doing. Then 90 days after that takes you out to 6 months. 6 months after that, provided everything is going well.
Right. Right.
And usually you have a couple of 6 months appointments, and then I've been yearly appointments for that forever.
Right. And what about your decision to proceed with orchiectomy, Ginger? Was that because you just mainly just wanted to kind of taper down your hormones, or was that a step that just made you feel that you were taking a step in the right direction? Or
Um,
both?
yeah, my hormones didn't change when I did my org. They stayed the same. Um, I got off the Spiro, which, diuretic, causes some other issues. So I was glad that was gone. It was also physically more comfortable to have some of that anatomy removed. It changed my silhouette down there, which allowed, different clothing choices. I was not as worried um, about what was going on. Um, the side effects, that cuts all your testosterone. And so, you do get further shrinkage, or I think most people do. Libido will adjust downward usually, sometimes a little, sometimes a lot. But physically, it made me more comfortable that I could move different, I could wear different clothes, and it was just less of a reminder of what was there.
Right, right. And just so everyone understands what kind of health literacy and understanding you were coming from, Ginger, you want to talk a little bit about your background in medicine, just for full disclosure?
Yes, yes. Going way back to the dark ages, I'm 63, so I'm old. Um, but way back after high school, I went into the Navy and went into the hospital corps in the Navy. Hospital corps is somewhere across between paramedics, medical assistants, most technicians. I worked in the operating room. I worked in the ear, nose, and throat clinic. Uh, Before that, I did almost a year doing sick call, literally seeing less critical patients and treating them under the authority of the doctor in the clinic. Um, so I had pretty good health literacy. After that, I worked some in insurance. I also worked some in healthcare, doing hands-on patient care. And then for 8 years, I was teaching at a small private healthcare academy where we trained technicians, and I wrote a lot of the curriculum that we used. So I was actually producing in-house textbooks. So I do have a lot of health literacy, and and I can usually answer questions. I know when I'm over my head, and I ask a lot of questions. And as I was going into this surgery, my knowledge got less and less. I asked more questions. Sometimes I already knew the answer, but I wanted to be reassured. And
Yeah.
so I was asking questions. I
Yeah,
was,
yeah. I mean, safe to say, there's always a little bit of always, regardless of what background our patients are coming from, we always want to make sure that we are, meeting them where they are and so on. So especially having somebody who is coming from a background of yours, and not to mention a colleague in a different role. There was a little bit of extra pressure, but in a good way. But I completely agree with you. And, it's I've been a patient myself, and sometimes, or, your family members, and, you do sometimes take a step back and really just want to make sure that you're understanding everything from the beginning to the end. And that's one of the important things that we try to handle when we have the initial meetings with you, where we talk to you about your past medical history, surgical history, social history, sexual health, what's
Mhm.
important to you, and so on. So really, for the remainder part of this little chat, Ginger, I want to focus on your surgical experience, uh,
Okay.
and because I know that you and I have had some discussion about really getting to know your new body and the challenges that come with that. That may not entirely be physical. A lot of it might be mental, psychological. And it's interesting that we don't really get a lot of opportunity to sit down with our patients and discuss some of those things, especially as surgeons. Yeah, I know
Mhm.
that you feel very strongly that therapy's been a critical part of your recovery. So take me through that time leading up to surgery.
Okay.
What were some of your reservations for you and your partner, perhaps? Talk a little bit about how important it is to have good social support going into surgery also.
Okay. Yeah, social support is critical. My family and I are estranged. Um, I tell people I moved from Atlanta to Cleveland for family reasons. The reason being the family is now 800 miles away in Atlanta, and that's better. Um, so I did not get or expect support there. I do have a very strong circle of chosen family, and I came out to a bunch of people. Well, came out, yes. I announced that I was going to have this surgery and what it was at the end of January. And by that point, I had told a couple of my closest um, friends, siblings, whatever, chosen siblings. And so I then made kind of a general announcement. That was easier than trying to remember who I told what and who knew and who didn't know and rumors flying around. Um, so I just announced it on Facebook to everybody. And that actually got me a lot of support and people who were very happy. Now, my account is locked down, it's private. The people who are on there are overall people I trust. Um, there were a few people that I was really surprised reached out with, hey, that's great kind of thing, just because they're not normally, they're a little bit more standoffish,
Mhm.
and yet they were very supportive. Um, I have, for better or worse, I've not had a lot of therapy. Here at the Metro Health, we do the informed consent model for hormones, and I tend to be pretty stable and work through things, so I haven't needed a lot.
Right.
Um, so when we were coming up to surgery, I looked at some lists and talked to, we've got two psychologists here, but because I work with them, they weren't comfortable doing the interviews and background and stuff for surgery, professional boundaries. And honestly, I wouldn't have been
Yeah, that makes
comfortable,
sense. Yeah.
for that with them. Um, so I looked and I found two counselors who met the criteria. The big problem, you've got two problems there on what is needed. The surgeons and what they require as far as clearance letters and other criteria, and what your insurance company wants.
Right.
My surgeons actually required more than the insurance company. The insurance company said one clearance letter was good. The surgeon said, no, we want two.
Sorry.
That's okay. It's okay. I actually got to meet a therapist that was really good. He does phone work for people at a distance,
Good.
and went through that. And then I met a second therapist here in who practices in Lakewood, and absolutely love working with her.
Good.
Um, and so I saw her for that. She did say that if I needed to, I could come back. A couple weeks later, as we're starting to move into, oh my goodness, I'm fixing to have major surgery. It's going to change my life, and it is pretty much irreversible because glue it back on is not an option.
Right.
Um, I personally have a fear of general anesthesia. I've had several surgeries, everything went well. It scares me. Um, and just the general stress of getting ready for this. So I
Right.
called I called Sharon, the therapist that I'd seen, and said, "Hey, could we get a couple of appointments? I'm just a lot of anxiety." That helped tremendously. She listened, she helped me deal with some of the anxiety. Um, she was very supportive. My wife was being very supportive, but she had her own anxiety going. And it's real easy for a couple knows each other and can calm each other down, or they can ramp each other up.
Right.
And so I started seeing Sharon, and it was wonderful to go in and talk to her and get a little bit of support.
Right.
And then right before surgery, my last appointment, I talked to her about post-op because I knew there was going to be some changes. I knew I was going to have pain. I knew I was going to have all that stuff. And I ended up booking 6, 7 appointments with her post-op. And that was absolutely probably the best choice I made out of the entire surgery of all the different choices that I had,
Right.
because she really supported me through adapting to all these changes. And it was so helpful. And I saw her, I had surgery on the 27th, in the hospital all week, got home the following week and saw her on Thursday. Or well, I was home the following week. I saw her on Thursday video.
Right. Yeah, I remember you talking about her, and again, as surgeons, we certainly want to practice holistic medicine in the sense that we want to provide psychological support as well as the surgical and medical in any way that we can. But understanding that medicine is a very complex field with, there's no way everyone can be good at everything. So
Mhm.
hearing about your experience has really made me prioritize getting behavioral therapy or psychotherapy of any sort set up for our patients. And for each one of our coming surgeries, we ask our therapists in-house to actually stop by at least one of the days in person and talk to the patients and kind of help them digest what's happened. Now, talk a little bit about how you have become more familiar with your anatomy, what your initial questions were. And it's interesting where you found a lot of your support in that regards amongst the cis friends that you have.
Yeah. Um, so, the first week I'm in the hospital, the entire area is covered with dressings. Dr. Vargas, the plastic surgery, came in day after surgery with her camera and showed me the picture before all the dressings were put on, and I was thrilled. It looked beautiful. Now, I know that directly after surgery, they get everything cleaned up and it looks perfect. And I will say, slight digression here, then I know that when the dressings come off, you are going to look like you were in a train wreck. Um, but Dr. Mishra and Dr. Vargas put a wound vac on, which is really cool technology. I won't go into details, but it helps reduce edema, the bruising and the swelling, and then a strong pressure dressing. So when all those dressings came off the Friday after surgery, um, it looked really good. There was some swelling. There was some slight under tissue bruising that you could sort of see if you looked at it at the right angle. It looked perfect. So kudos on that. That was so nice to not look down there and have a train wreck. Um,
Glad to hear.
yes. One of the problems, unless you are super flexible, looking at that area yourself is a little difficult. And I am not that flexible. I am old and chubby, and I don't bend that way. Um, and then immediately after, it's a healing surgical site. It looks good. It's closed, but it's painful. There's drainage. You're having to do post-op things to it. And I was aware, okay, that's my new body. Way up here in the I guess the front part of my brain, I don't know, whatever part of my brain I think with. I'm never sure about that. Um, but I didn't have any connection to it. It was completely foreign. And so it took a little while. And part of what I grappled with was drainage, which has some odors. I didn't have any infection, but there's some drainage and that has some odor. Um, Discomfort. My pain levels were not bad. I had a little bit of opioid, but mostly it was handled very well with Tylenol. I was really surprised at how little bad pain that I had. Um, but you know, I was aware it was there. I was aware of the drainage, the pain. I got a urinary tract infection, which is not uncommon after having a catheter for 5 days. And so I was dealing with that and the medication for that. And all of the stress about smelling bad and not being able to take care of myself, not being clean, just came smashing down on me. And you know, some of it got taken care of. I mean, I was put on antibiotics and stuff for the UTI. Um, that was a brand new that's a brand new experience. People with a penis very rarely get a UTI.
Right.
Uh, People with a vulva and vagina, it's more common. I don't want to do that again. You know, tried it once, do not recommend.
You do not
Um,
recommend, right?
but
Yeah.
then there was issues around um, it operates differently. So when you go to urinate, it's not a hose with a hole in the end. It's up in, there's the labia, the flaps, if you will, and those are still somewhat swollen from post-op. I'm learning hygiene, and it's on an area that is very tender. And I'm also a little bit afraid to be aggressive because I don't want something to fall off because I rub too hard because I'm just post-op.
Right.
Dr. Vargas did assure me that that wasn't going to happen. Um,
You aren't just gonna rub off your new vagina.
yeah. She said, "Oh no, I sewed everything down really good.
That's good. That's good.
you're not gonna knock something off." Um, but it it was really psychologically very difficult. And
Right.
I went in and just poured my guts out about it to Sharon, my therapist, and she was able to talk very frankly. She's a cisgender woman. She has had this equipment all of her life. And she talked very frankly, very clearly about some of the realities of the hygiene and taking care of it and being aware. And I don't think I ever would have gone down the path of, oh my God, this is a mistake, put it back. But I could very well have had a harder time relating to it and feeling comfortable because I was headed there.
Right.
And instead, I was like, oh, this is normal. I'm normal. I can do these different things. And then about a week later, I saw Dr. Vargas again, and she also a cisgender woman, and we had a somewhat similar discussion. And there
Right.
were two residents in the room who are women, cis women, and they kind of chimed in a little bit. And yes, this is some of the normal stuff, and made some suggestions.
Right.
And it was like, oh, okay, I'm actually normal. I can do these different things. I can be comfortable.
Right. Right. Yeah, and it's an evolving thing too, because as you mentioned, immediately after surgery, regardless of what we do to minimize the swelling, whether it be the compression dressings or any kind of medication to decrease the inflammation and so on. I mean, there's been major rearrangement of the tissue down there, so there's going to be inflammation.
Right.
So, I remember our early kind of post-operative meetings. You did say that you were having some spraying and so on. And I remember
Hmm.
talking to you and reassuring you that, yeah, there's some swelling and you're probably just the streams, probably hitting some of the surrounding tissue, and perhaps there's some edema of the urethra itself, which is the tube that you urinate through. But sounds like over time your stream has gotten better and as the swelling has subsided.
Yes. Yes, I described it to a friend the first 2 or 3 times that I actually urinated. I described it as it was like going through a car wash with the windows down.
Yeah,
And it was because you have to sit a little bit differently,
right.
angle your body a little bit differently. As Dr. Mishra said, there was swelling, and so that was getting in the way.
Right.
Over the next couple of weeks, a couple of weeks later, I told somebody, I said, about 50% of the time it operates as expected. About 25% of the time, there's a little bit of some sort of weird side spray thing. And about 25% of the time, it's like, oh my, I
Right.
need a shower. But that would be after I had been sitting up for a while or doing something. And so there was a little bit more edema had built back up. At
Right.
this point, no problem with any of that. Um,
Good.
you know,
Good.
my wife and I were actually talking about it, and we were talking about some of the, I mean, it operates different, like I said.
Yeah.
And and she said she was a little bit jealous because one of the issues that she has, I don't have to deal with
Mm.
where some of the urine ends up at times. And that
Right.
has not been a problem. Sometimes it kind of goes backward.
Right. Right.
I
Yeah.
don't have that issue. Um,
Yeah.
and so, yeah,
No,
at this point, it's not an issue.
good. Good. I'm really glad to hear that. Now, the risk of perhaps being a little more personal here, Ginger. And I'm really happy that you have taken the opportunity to share with our patients. Talk a little bit about your sensation, both kind of mechanical sensation down there as well as uh, orgasmic sensation that
Right.
you may have experienced or maybe not experiencing.
Yeah. Okay. Um, Immediately post-op, there was not a lot of sensation. And the sensation that there was when I moved, and it was uncomfortable to painful. Once I got home and got over, and y'all plan on this. The day that I went home, and I did take a shower, that was one of the first things that I did, was I took a shower because nasty. I wanted to wash the hospital off. Um, and by the time I was able to lay down, I was in so much pain. I felt like biting everybody but my puppy. And because my puppy comes and lays next to me and cuddles. Um, but that subsided. By the next day it was better. And part of it was post-op pain. Part of it was getting up and moving after 5 days, a lot of time in bed. And part of it was getting home and I didn't have all those nice grab bars to get
Right.
off the toilet, to get out of bed, to do all that stuff. So I was
Right.
just in a lot of pain. Um, but then I also started noticing weird electricity shocks, feeling like somebody was stabbing a needle in. That is the nerves coming back, waking up, saying, "What the heck did you do?" Um, and that went on even, I mean, I'm 8 weeks out. And yesterday I had this very weird sensation for just a minute, and it was partly electrical, partly feeling like something was pinching, and it felt like some of the old anatomy was there. It felt like on that. Well, what that is nerves from the old anatomy that are now in a different place, kind of waking up and firing, and my brain still has that map to what it was.
Right.
Um, I got used to touching and being touched. Um, I did have a little area open up that we had to put a little tiny dressing on, and I mean like fingernail size, little bit of, it's called Aquacel. It's this foamy stuff. Um, and so being touched a little bit, having exams, I was aware of touch. I started being aware of that. When I was washing, I started being aware. Um, when everything was pretty well healed and I talked to Dr. Vargas, um, and she said, yeah, you can explore some. It's safe. And I did explore some. And the sensations, some areas were still not responding. Some areas started mapping pretty well. And I was aware with my fingers what I was touching, but also my brain on the inside was saying, oh, okay, that's that, and that feels good, or, or like I said, some areas were still not responding. Um, how can I say this? The clitoral area works as expected with the expected results. Um, we've not done a whole lot because I'm still healing and I'm back at work, so I'm a little bit sore from that. Um, but I do have good sensation.
Good,
And
good.
and I knew that that could be anywhere from fairly quick to up to what, 18 months, I think sometimes.
Yeah, yeah. I mean, it can really vary for people,
Yeah.
but usually 3 months is kind of where I tell people to expect orgasmic sensation. So,
Hmm.
I mean, you're
Yeah.
certainly right on track, if not ahead.
Yeah.
But
I try to
yeah,
be an
that's
overachiever.
right, right, which is why we like you. Well, that's yeah. And as we kind of wrap up here, Ginger, I want to give you the platform to kind of talk a little bit about just your overall experience with all this. I know you're very active in the community here, and
Hmm.
you're one of the people who has a lot of influence within the population in Cleveland. You're certainly endorsed for it, and with the changing political climate. I know that that's something that directly impacts you, your friends, us overall. So I just want to give you a chance to just talk a little bit about things that are important to you, things that you would give advice to your friends and other people who are seeking this kind of surgery.
Okay. Thank you. First bit of advice, seek out surgeons that you trust. Um, get the latest technical aspects of the surgery, the most up to date. There are some older procedures that work, newer procedures work better. They're less traumatic, they give better long-term results. So, make sure what your surgeon is doing, what techniques. Um, but don't be afraid to shop around. The hospital experience is also critical. I am very happy to say here at the Metro Health, there were absolutely zero problems. And only one of the nurses even knew who I was. I work a lot on the outpatient side. I don't have much contact on the inpatient side. And one of the nurses, as we were talking, said, "Oh, I know who you are." The rest of them had no idea. I was simply another patient. A lot of them didn't even realize, because my chart doesn't really say it, that I was an employee. And I had absolutely incredible care. So it's not just the pre-op and operative time, it's how you're treated in the hospital and if you feel safe. And I absolutely did. Um, I can't say this enough. I highly recommend that you make appointments and keep them with a therapist post-op, whether they're over the phone or in person. That was something that got me going. My first post-op appointment with my therapist was on the phone. The rest of them I went in person. And that was an outing that I could do. I could drive over there, I could walk in, and that was mentally very good for me just doing that.
Uh,
Um, I would recommend a cis woman as a therapist simply because there's going to be a level of understanding.
uh,
But that's just that's up to you. Um, talk ahead of time. Possibly some of the most traumatic stuff that happens psychologically was some of the post-op examinations, where you go in and this is a new experience. Getting on that table and laying down and putting your feet in the stirrups and having somebody come in and look at you. There is absolutely nothing that I have ever experienced medically that had that level of a feeling of being invaded. Um, it the first one was not at all uncomfortable. The second one was, I had a little bit of granulation tissue, and so there was a little bit of a procedure that had to be taken care of. And so physically it was uncomfortable. Psychologically, it was traumatic. I talked to my wife, I talked to a couple of my cis friends, I talked to my therapist. I wish I had done a little bit more of that ahead of time. It's still, I've had several more exams since then. Um, I hate it. But if you talk
sorry,
to
sorry
cis,
to put you through that, but the culprit,
well,
the culprit is present. But
yes,
yeah,
you
I
know,
totally hear you on that part, and I think it's interesting because if, I'm sure your cis friends and my family members who ever had to go through that, and other patients, and they're like,
Mhm.
oh, this is the worst part, and like, and until you really go through it, I'm not sure if there's anything anyone can really tell you to fully prepare you for it, especially as you mentioned, there's if we see any granulation tissue in the canal or anything like that,
Mhm.
we want to try to remove that. So yeah, I
Yes.
mean, I think
Yeah.
that's a great piece of advice.
Yeah. And with both of them, the first two, I literally got out of the shower, put on my clothes, went to the clinic. The first one was Dr. Vargas. It was every bit as psychologically invasive. Physically, she looked. At that point, there wasn't any procedure that needed to be done. A couple weeks later, I saw Dr. Mishra. That was when the granulation tissue needed to be addressed. But I literally out of the shower, clothes on, drive to the clinic, and I'm walking back there wondering how I will smell, if I'm going to be offensive, all those things, all those messages. Um, and so there's multiple layers of psychology there. Um, as far as day-to-day life, um, I have a bunch of tattoos. And when I get a new tattoo, my tattoos are mostly in places that can be seen depending on what I'm wearing. When I get a new tattoo, everybody knows I'm showing everybody. Um, as my top grew, it was like, people could see. With this, on the one hand, I want to go dancing down the road showing everybody. On the other hand, it's very personal and I don't need to show anybody except a very small circle, my wife, my doctors. There's nobody else that really needs to see it. And I really don't want to. I did
Um,
show one friend a picture. She does a lot of my ink therapy, and she's been through some medical stuff too. And I did show her a picture. I haven't shown anybody else any part of this, and I don't want to.
right, right.
Um, and so it was weird when I realized, yeah, I want to show people. I really don't. It's very personal and private.
Yeah, yeah. You did get some new ink though, right?
Yes,
In
yes,
celebration.
I got it. It's hard to see here in the camera, but I got going all the way up my forearm.
Yeah.
It's like a flower, but there's a caterpillar that's in muted browns,
Uh-huh.
and then and the leaf next to the caterpillar is in kind of muted browns, and then the next leaf up is green and vibrant, and the butterfly is just kind of exploding with color.
Yeah. Yeah. No, I saw it in person. It looked gorgeous. So I'm certain that it's healed up beautifully. Um,
Yes.
Well, Ginger, I this has been fantastic, and it's like I said, it's not too often that we get a chance to sit down with our patients and have such frank discourse about their experience, and I certainly can say that I'm very privileged to have the chance to take care of you, and I'm sure Dr. Vargas would agree with that. And it's been a historical thing here at Metro. You're the first person to undergo a vaginoplasty here, and we certainly hope to build on that more. And I know that in your role, you're constantly endorsing for patients and the community overall, and it's a pleasure to have you around, be a part of the team, and as we work with more patients, and you've been gracious enough to say that you're happy to talk to them, so I'm certain
Oh
they will
yeah.
benefit from this as well. So,
Yeah.
well, thank you very much, and I hope that our future patients and even those who are not coming to us necessarily will benefit from this discussion. And I look forward to seeing you soon.
All right. Thank you.
All righty, have a good
All
one.
right. All
Bye.
right. Thanks. Bye
All
bye.
right, bye.
And we are